Hello mothers, good evening. Let's today now see what are the other factors that would help mothers successfully breastfeed their babies. We had seen certain important aspects yesterday, and today I am going to probably talk to you and discuss to you about how a milk is produced, how a baby needs to be put to the breast properly, how to verify whether the baby is properly attached to the breast so that it is capable of getting enough milk from the mother without much effort. And two, what are the problems if the baby is not properly positioned and attached? What are the problems the mother faces? What are the problems the baby faces? So let's first understand as to how milk is probably produced in the breast. She is offering her breast to the baby. Now she is gently stimulating with her breast nipple the baby's mouth so that the baby, what it does by a reflex called rooting reflex, the baby opens its mouth wide. So once the baby opens the mouth wide, the mother is going to offer her breast, and the baby, you must see to that the baby holds to the not the nipple but the areola into its mouth. So the successful breastfeeding comes when the baby is offered most of the breast into its mouth, which means mainly the areolar part. That is where the lactiferous sinus are all conglomerating and squeezing on this areola only ejects the milk through the nipples. So it is not the feeding at the nipple, but it is feeding at the areola. So here the mother is stimulating the baby and stimulating the rooting reflex to hold to the breast. And I showed you how the milk secretion is happening, that the basic unit is the alveoli. From there the milk is produced and it goes into the lactiferous ducts and gets gathered in the lactiferous sinuses under the areola. And you have the brain breast axis, hormonal axis, where two important hormones, prolactin and oxytocin, are so very important in the production of milk and in the ejection of milk, which is responsible for the let down reflex that the mother experiences when the baby is feeding. So that's about the basic structure and the of the physiology on how milk is produced and the baby gets the milk. Now we next saw the proper positioning, that is very, very important for the baby to comfortably. Most common position that is used is the baby's head and neck are being supported with the bend of the elbow, and the baby's abdomen is touching the mother's abdomen, and the baby is turned towards the mother. So that's one of the most common comfortable position for mothers that we call as a cradle posture, and the mother supporting with one other hand her breast. The type of support the mother offers to the breast will depend on the type of breast she is having, either a C support or it's a little bulkier one, a U support. So that's the common position that we've been seeing, sitting down comfortably with a backrest without having much back pain or neck pain. So see, being seated comfortably by the mother with the back support is also important for successful breastfeeding. Then holding the baby and positioning the baby is the next most important thing. The third most important thing is the latching of the baby to the breast. We call attachment of the baby to the breast, and you could see here the mother is making the baby open the mouth wide. She is gently taking her breast and with the help of our nipple she is stimulating the corners of the baby's mouth. The baby immediately, by a reflex called rooting reflex, turns towards the breast and opens the mouth wide open. When the baby turns the head towards the mother's breast and opens the mouth wide open, the mother must offer the breast to the baby. And we would see in the next picture how there is an alternative way of stimulating the rooting reflex. She is gently scratching the corners of the baby's mouth. The baby would immediately turn towards that side and open the mouth. So this one other way, either she can use a nipple to stimulate the baby's opening of the mouth, or she could stimulate with her little finger the baby's corner of the mouth, so that that rooting reflex is stimulated and the baby turns towards the mother's breast. Now you could see in this picture how the mother offers the nipple and the breast into the babies. You could see that the baby is properly latched now. There are 4 signs to verify whether the baby is properly latched. See here, the baby is holding the baby in cradle position. Baby is well positioned. Baby is also well attached. How to know well attached? There are 4 signs for successful attachment that you must verify. You could see the in this picture, the chin of the baby is touching the breast of the mother. So chin touching the breast. Then the baby's mouth is wide open. 2, the lower lip must be turned outwards. 4, more areola is visible above than below. So if the baby takes most of the areola into the mouth, because taking the areola into the mouth and sucking on the areola is so important for ejection of the milk. It is not sucking on the nipple. It must suck on the correct holding, and and you could see how the mother positions the baby and gives feeds to the baby. These are all proper positioning that you see. How is the body is supported, how is the breast is supported, how the baby is properly latched to the nipple and areola. Now, this picture is one of the most important picture to show you how actually the baby gets the milk. Now, we know we call it simply sucking, but I want you to know that sucking means 2 things. 1, siphoning like in a straw. 2, what you call as probably like sucking on a sweet, squeezing. So there are 2 things, 1 siphoning, another is squeezing. Now here, if the child on the breast, it is taking the whole of the areola in its mouth and it is sucking on the areola, which means it is like sucking on the sweet. It sucks on the areola so that the milk from the lactiferous sinuses is ejected through the nipple into the mouth. So you could see this picture, how when the baby squeezes the areola, the milk is flowing into the mouth. So that's very important. So it is actually squeezing on the areola. It is not sucking on the nipple. So this is very, very important. If mothers don't understand this physiology, and if the baby is well attached and she thinks baby is taking in the whole of the areola into the mouth and it may get choked, and many mothers mistakenly pull their babies out and offer the nipple alone. When they are offering the nipple alone, the baby tries to suck more and more, and this leads to a lot of harm to the nipple, as well as the baby, it ends up in the baby swallowing a lot of air. So this thing of squeezing on the areola by taking most of the areola into the baby's mouth is very, very important. Though we call it suctioning, sucking at the breast, it's actually squeezing on the areola by the baby, like sucking on the sweet, that the baby gets more milk ejected from the lactiferous sinuses through the nipple into the baby's mouth, which the baby swallows at repeated intervals with deep, long passes. So when you see a baby sucking for some time, then go for deep, long passes of swallowing, then sucking again, which means the baby is properly attached and is sucking well. So one needs to understand this basic principle of baby should squeeze on the areola by keeping the areola into the mouth and not holding on to the nipple. That's very, very important. So there are breastfeeding techniques, other positions. One other technique that is followed where you see the football position. Mother is keeping the baby within on the lap, within their arms, as if holding a football. And this was one other way, and she is supporting the baby. Here baby is supported by a pillow also on the lap. So you could use additional things like a pillow or some banded supports that are now available for mothers to help hold their baby straight, because some of the big babies may put a lot of strain on the mother's hand and elbow, and that may make them tired very easily. So supports are available which they can tie to their waist and then put the baby on the waist. So this is another thing, football position of positioning the baby. Then this is the another position. This is the position that most mothers would do feeding after cesarean sections in the first 2 or 3 days before they are comfortable sitting down and have a lot of energy to sit for longer hours of time feeding. So feeding lying down is also important. Here all the other principles that we have told will apply, but only thing here, care should be taken to support the head. Head should be raised slightly up. The head should not be lower down than the breast. If the head is low down, then get into its nostrils. So this one other position, lying down position, where the baby is taken all of the areola into its mouth, and so that the baby is able to swallow comfortably whatever milk that is coming into its mouth. Now, the same principle that we have told before of siphoning, like what it happens in a bottle. See, in bottle feeding, the baby is siphoning, sucking on the nipple and siphoning or sucking through like in a straw. So milk is entering the mouth with large amount of force because it is pulling the milk. But whereas here, when it's feeding on the breast, it is squeezing on the areola, and the milk flow is so smooth and streamed that the chances of baby getting aspirated is very, very less. So bottle feeding increases chances of aspiration. You see, the breastfeeding does not increase the risk of aspiration. Actually, it makes the baby more satisfied by feeding on the breast rather than on the bottle. Less work or less effort is needed by the baby while it is feeding on breast, whereas when it is feeding on the bottle, it needs a lot of support. So bottle feeding is not good for babies. Bottle feeding leads to a lot of problems of more effort, more activity for the baby. Two, it also leads to more amount of air swallowing, more risk of aspiration. So learn to properly position the baby, learn to attach the baby, know that the baby must take most of the areola into its mouth and then squeeze on the areola to feed successfully. Start getting more milk into the breast. Frequently the breast gets engorged and it becomes painful. So engorged breast is a painful condition that the mothers undergo many a time. That is because of the too copious secretions that sometimes is the problem. And what happens during this time? Slowly, we have seen yesterday that this copious amount of milk, excess milk, slowly gets streamlined, and the mother's breast starts secreting only what from engorgement is to make the baby frequently feed at the breast. So keep emptying the breast frequently by making the baby feed frequently. So your milk is emptied and the breast engorged. In a nursery, we don't let out this milk, but we store this milk and use it for the baby when mother wants to take rest, or probably use it for other babies after pasteurization and testing the milk. And when mother's having engorged breast, she could also use warm water sponges or fermentations to reduce the pain and engorgement. But what mothers must be reassured that this engorgement of the breast that is seen in the first few days is only a temporary phenomenon, and after some time the milk secretion slowly gets streamlined and altered so that the mothers secrete only holding to the breast properly if it is not properly attached. What happens when the baby is holding only on the nipple and pulling on the nipple? So a lot of friction happens between the tongue, the lip and the nipple, and this causes undue soreness, sometimes leading to painful soreness, cracked nipples, and sometimes bleeding from nipples. And this pain becomes an inhibiting factor for secretion of more milk, and the milk secretion stops slowly down, and the mother also gets discouraged to feeding because what goes through the mind when our baby feeds is the pain rather than the joy. So you need to be very careful when the baby, to verify whether the baby is properly attached to the breast, whether it is taken the areola into its mouth or holding only onto the nipple. So making this successful is to make the baby open the mouth wide and offer most of the breast or so that most of the areola in its mouth, so that you could avoid this sore nipple and cracked nipples. And if it has happened already, correct the positioning and latching And two, we normally advise the mothers to apply the hind milk. Hind milk is rich in fat, which is like a lanolin. That's a natural lanolin. It's got a lot of healing properties. We know breast milk has got a lot of antibodies, a lot of cellular elements. It has got healing properties. So just simply applying this hind milk onto the areola and nipple and allowing the breast to be dry. Whenever she gets time, private time, she could expose the nipple and areola to air so that it's not wet and sodden and undergoes chafing, and this dryness will heal the soreness of the nipple fast. So proper positioning and latching, then if it has happened, application of hind milk and exposure to air is one way of getting relief from sore nipples. Then there is this breast massage that many mothers do if they have very little secretions or if there is too much engorgement. Many times when the breast is full and too much engorged, baby may not be able to hold on to the breast. So baby is hungry, but it cannot hold on to the areola. It opens the mouth wide, but because breast is engorged, it is not able to take the areola and it starts crying. During this time into the mouth and also gives relief from the amount of milk is let out through this manual use subsequently for the same baby or for other babies. And so breast massage is one sometimes done by mothers just before offering feeds to these babies. So we have seen some of the problems also, and we have understood what is the difference between the sucking and what actually we mean by sucking. And there is no need for any preparation of the breast before feeding. All the mother needs to be is clean. Taking a bath every day in the morning is quite sufficient. And if milk has been sodden for a longer time, just wiping gently with a wet towel is all that is necessary. But the most important thing is positioning the baby and just verifying whether baby is attached to the breast, the areola and nipple, and how to get relief from that. And now, rusty milk is one which is having blood in the milk. So some mothers get so fretful when they see blood in their milk. Why it's happening? Whether they can offer this milk to the baby. A rusty milk is a safe milk. That's because when breasts are getting engorged more and the babies are sucking vigorously, some of the lactiferous sinuses distend too much and get ruptured, and this ruptured lactiferous ducts and sinuses release amount of blood, and this blood is visible in the milk, and this milk is safe to be given to babies. Mothers need not worry that it is harmful to give rusty milk. Rusty milk is very safe and is common. Mothers also need not get worried about seeing small amount of blood in the breast milk. That's physiological, and only if it persists for a longer time or mothers have some lump in the breast, and if they are having this rusty milk, then they need to consult a doctor. Otherwise, you can just ignore it as one other physiological happening. And after feeding, how to make put the baby to sleep. Now we have seen after feeding, babies normally doze off to sleep when the stomach is full because they become satiated. Milk from one breast completely, and probably alternate the breast during feeding so that the baby gets the advantage of both the fore milk and the hind milk, because both contains little bit different composition and little bit advantages. So a baby should be offered one breast at a time, and it should take most of the milk from that, including fore milk and hind milk, and offer the breast if the baby is wanting more, the next breast, and otherwise alternate the breast during each feeding so the baby gets advantage of the fore milk and hind milk. So rusty milk is safe, and try to offer both the fore milk and hind milk by completely putting the baby and making it empty one breast. Two, when you are putting it to sleep, put it on the right lateral position. Right lateral position is the most comfortable position that helps in digestion as well as for the comfort of the baby. So make them sleep on the side. But before putting them down to sleep, because they are already dozed off to sleep, now I would suggest mothers to try burping the baby. Burping is not compulsory, but some babies who are having the habit of with a lot of noise, these gaseous eructations, then probably here is a baby that probably has swallowed a lot of air also in his vigorousness while feeding, and that babies need facilitation of bringing out this air by following burping the baby. So there are several ways, techniques of burping the baby. The best simple way is to put it onto the shoulders and just simply gently tap on the baby's back. Then the baby burps 1 or 2 times. Then put it back to sleep in the right lateral position. Then this small amount of spitting of baby when they are awake is normal. That need not worry. Probably we call sometimes babies feed more than what they need. Usually this happens when mother has related or overfeeding related. One way of knowing is if a baby is voiding frequent urine, if a baby is passing normal frequent stools, then if the baby is gaining good weight, we know that this vomiting is not wrong. This vomiting is only physiological and will not harm the baby. But a vomiting baby, if it is not gaining weight, if it is not passing adequate urine, if it is not passing adequate stool, then it's a time for concern. So a baby who is vomiting and not gaining weight or growing or not passing enough stools and urine, it's one of the danger signs. You have to consult your doctor to find out what is the reason for failure to grow and this vomiting. Now, there is some questions that have come up. One of the things is my child is 3 years. She wants to breastfeed. Can I continue? I think you can continue breastfeeding as long as you want. But normally, by 2 years, most baby becomes less interested in feeding from the mother. And by this time, brain growth is also complete. And the compulsion that you need to give breast milk is not there. But there are 2 ways of thought. Normally, up to 5 years, people agree, up to 5 years. But beyond 5 years, they say the baby may not become self-sufficient. And it may not have its individual personality develop. So they say feeding for too long a time is not also very good. But feeding up to 2 years is compulsory, mandatory. But feeding little beyond 2 years, no problem. Many babies do this during night time. They want to continue with the breastfeeds, and it is left to the mother and the baby to adapt to that, and there is no harm is done. Then there is another question that popped up saying whether a mother can breastfeed if she has COVID. True. COVID mothers, there are 2 sets of mothers, I put it. Asymptomatic mothers who are not having much problems, without no complications. They are not having breathlessness. They are not having too much cough, fever. She is now capable of sitting down and feeding. Yes, she can continue to breastfeed. She must continue to breastfeed because COVID doesn't spread through breast milk. Only COVID antibodies may probably be transmitted through breast milk and protect the baby from getting COVID. Only thing, mothers who are having COVID and breastfeeding should follow the principles of preventing the spread of wearing a mask while feeding, then washing their hands before and after feeding, and then not avoiding too much contact with others, and giving the baby after feeding to a caretaker who is not infected, so that she gets the baby only during the time of feeding, so that you are reducing the contact time with the mother. And in this way, they have found that it offers more advantage for the mother during COVID to breastfeed rather than to feed some other feeding, because that causes more harm mentally and physically to the babies. So COVID mothers can breastfeed unless the mother is very sick. Suppose the mother is very sick in an ICU, then it becomes difficult for the mother to feed. During this time also, if the mother wants to give her breast milk, express breast milk can be taken from the mother, then pasteurized. But mothers most often who are not very sick, who are not in an ICU, must continue breastfeeding a baby. Can a vaccinated mother breastfeed? I take it as probable reference to a mother who has taken COVID vaccine. Yes, definitely. COVID vaccine is harmless to the mother. It is harmless to the fetus that is growing in utero. It is harmless to the baby. So A vaccinated mother can even carry the baby to the vaccination center, continue feeding, feed before vaccination, feed after vaccination, and must continue to feed longer after vaccination till 2 years of time. So vaccination is not a contraindication for feeding. They definitely should feed after vaccination. And there is one more question I think we have touched, but anyway, I'll tell you how do we clean the breast before feeding, what precaution to be taken. Actually, there is not much necessary to clean the breast. A daily bath in the morning is all that is sufficient. But mothers who continue to secrete a lot of milk, and if their braces are all become wet with milk, and if there is a little bit of foul smell, probably they can wipe their breast with wet towels and then offer the breast. This is sometimes done in our humid tropical climates where a lot of mothers sweat a lot. This sweat sometimes repels babies from taking to breast. We have seen mothers who sweat a lot. Babies sometimes don't like the smell of the sweat and get repelled and not take to breastfeed. So during this time, gently ask to start breastfeeding. Otherwise, there is no specific washes or any chemicals need to be applied for any preparations for starting feeding to the baby. Now, I think I must touch upon one important thing because many mothers may also have premature babies, and these premature babies are a real tough task for mothers to lead because the doctors would have told them that the baby needs to be looked after carefully, that the baby needs to be fed properly if it needs to grow safely. So this puts a lot of pressure on the babies, but what is important, premature babies need breast milk. The only milk that ensures survival, complete survival of babies is breast milk for premature babies. That is why even in very sick babies in an intensive care unit, the practice of colostrum swabbing, we call it colostrum swabbing. We take the colostrum from the mother and then swab it into the baby's mouth who is still not having the capability to feed. Imagine a 900-gram baby, a 700-gram baby who is still sick and is not having the capacity to feed. These babies are offered this colostrum as colostrum swabs into their mouth. We have found that colostrum is endowing lot of benefits in terms of immunity, preventing sepsis and other complications in the newborn. So colostrum swabbing, that is feeding of this colostrum through a swab, is one of the methods that is used for actually making the smaller babies survive in an NICU. And after they come out of the NICU, mothers must feed their breast milk. And only thing, because these babies are tiny tots, they are having small stomach capacity. Now the mother needs to feed them frequently. Unlike babies who have been born term baby and about more than 2.5 to 3 kg, babies who are born very premature may need frequent feeds. If they are two small babies, about 1 and 1.2 kgs, maybe they are fed every 1 hour. If they are 1.5 kg to 2 kg, they are fed every 2 hours. If they are more than 2 to 2.5, they are fed every 3 hours. And all babies who have become well, they are fed according to demand. So premature babies, the mother's milk of premature babies. Suppose a mother has given birth to a premature baby, that mother's milk is having a unique composition. That's very, very important. That is best suited for the premature baby. So the composition of the mother who has delivered a preterm baby is distinctly different to suit, though the baby may be supplemented with some fortifiers in a nursery, but once it comes out of the nursery, all mothers must know feeding their breast milk ensures better survival, better growth, better development, lesser neural disability, lesser ROP and other complications. And we've been seeing how feeding one full breast one time at a time is also very important, because there are certain factors of fore milk and hind milk, because when coming to feeding premature babies, it's more important that a mother offers the more of the hind milk that is containing lot amount of fat that will promote lot of weight gain in this premature babies. And the fore milk contains lot of lactose, which is energy. So baby gets energy faster in fore milk. The baby gets the properties of gaining more weight in the hind milk. So if the baby is offered both the things, baby gets both the advantage. Thank you mothers for your patience listening, and so far we have been seeing how to successfully breastfeed a baby, various aspects that go into feeding a baby properly, and how to be relaxed and comfortable by feeding, and how to make the baby take good amount of feeds and grow healthy. We have seen several aspects from physiology to practical points, and some of the problems that that may crop up during breastfeeding, and how to avoid them, and also how to cure them or get that solved. And we have been seeing all that. In between, we had some few technical glitches that interrupted our discussion. I probably apologize for that small technical glitches. Otherwise, I think today we have done a lot of learning lessons on successful breastfeeding, and thank you very much, mothers.